Tonight, Australian hospitals on life support. With cases of flu and COVID on the rise, pandemic-fuelled burnout and crippling staff shortages, just as we head into winter. So how do we fix a system that insiders say is on the brink?
The growing crisis in the health system.
Conditions within hospitals are worse now than they were at the peak of the pandemic.
Hospital crisis facing every state.
The pandemic has exposed a system already broken.
There's been increasing demand on the emergency departments in the public hospital system year on year.
Dr Sarah Whitelaw has worked in emergency for more than 20 years.
We have this perfect storm of increasing demand, the challenges of COVID and flu, and a decreased number of staff who are pretty exhausted. I'm worried about the number of people that have silently just left the system altogether.
In a bid to rebuild a dwindling workforce, South Australia has promised 350 more paramedics. Victoria set to hire 7,000 more healthcare workers. New South Wales today pledging more than 10,000 new allied health workers.
The biggest boost in our health workforce in our state's history and the largest in the country.
Meanwhile, the federal government has promised a nurse in every aged care home. That's 14,000 extra staff.
They're not growing on trees, and if you want to grow them, it takes 5 to 10 years. There is a workforce crisis.
I know that there's a skills crisis. I made it clear that one of the things that we would look at in the short term was migration to solve some of those issues.
In South Australia, promises to increase hospital funding and fix the state's ramping crisis, where ambulances wait outside hospitals, propelled the new Labor government to power. This weekend, the Premier observed the crisis up close, riding in the back of an ambulance.
You know it's bad, right, because you talk to staff and you see it on the nightly news, but when you see it firsthand, it's full on.
Ambulance ramping has reached new record levels in the state. Last month alone, South Australian patients spent 3,412 hours ramped outside hospitals instead of being treated inside.
We have been predicting this for a number of years now, and we feel exhausted at the thought that there isn't any light at the end of the tunnel.
And the South Australian Premier joins us now. Premier, you were in the back of an ambulance. Was this a publicity stunt, or were you really setting out to see what it was like?
Our ambulance service here in South Australia, Chrissy, has been under extraordinary pressure. And you can read all the briefs in the world, but when you see something firsthand, it actually has a big impact. And it certainly has informed many of the discussions I've been having throughout the day with the team in SA Health. And I think it's a great example of how hard our ambulance service is working here in South Australia, which I know is also true across the rest of the country at the moment.
Premier, you're in competition with every state to recruit these paramedics. I'm a South Australian lover, but you've got to convince people to move there. How are you going to actually do that?
Well, it's a great place to live. Don't just have to believe me. It's the most livable city in the nation, according to a whole range of international metrics. It's the third most livable city in the world, according to The Economist. So, look, we're very proud of what we have here in South Australia. We've got exceptional public services, a great standard of living, but most importantly, we've got an economy that's been transitioning at pace and is now performing as well as it ever has in our history. So we're pretty optimistic about the future, pricing. If you look at the global challenges that we confront as a nation at the moment, you've got global insecurity, which means more money coming towards defence, space and cyber, which our state punches above its weight in. But then also when it comes to the challenge of decarbonising heavy industry, South Australia is ahead of the rest of the nation when it comes to the take-up in renewables. And my government's got a massive plan to invest heavily in the hydrogen sector, where we believe South Australia will be the national leader.
But Peter, everywhere we look in this nation, governments at state, territory and federal level are promising more staff, more workers in the system, whether it be paramedics or nurses in aged care homes. Specifically, are you going to be talking to the federal government about making it easier to recruit people from overseas? Because that is what is needed.
Look, that is an option. It's also an option to invest more in training locally. But what we really need from the federal
government... That's
longer
term, right? You need these staff pretty promptly. The federal government's promising nurses in every nursing home across the country. These people don't arrive out of nowhere.
Look, skilled migration is certainly part of the equation, and we want to work with the federal government to help facilitate that. But at some point, though, we've got to start thinking about the long term. I think the Australian community is desperate for political leadership that isn't just focused on the immediate future to get past an election cycle, but also think about the long term, the next generation. And what we desperately need is a federal government working with state governments on how we can collaboratively address people coming to the hospital system that quite frankly don't need to. We've got a lot of people who end up coming from aged care into hospital only to go back again to have a revolving door. So investments in aged care is important. But just as important is what we do around GPs. On Saturday night, we picked up a gentleman that ultimately had to go to hospital, but had there been a 24/7 GP clinic more accessible, available in the early hours of Sunday morning, they may have got a better patient outcome at far lesser expense to the taxpayer. We've got to start to confront this challenge about the primary healthcare system run by the Commonwealth working more collaboratively with the hospital system that's run by the states.
Premier, we've run out of time. Thank you so much for joining us tonight.
I appreciate it, guys. Cheers.